Surgery. That's the word doctors sometimes bring up when they see this. A gap down the middle of your stomach, bad enough to need anesthesia, an operating table, months of recovery. And here's what should genuinely scare you. The exercise you've been doing to fix it might be the exact thing making it worse. It's called diastasisrecti. Stop thinking it's just a mom's condition. Men get it. Women who've never been pregnant get it. It happens to anyone whose core has taken the wrong kind of pressure, the wrong way, for too long. And crunches, the exercise most of us were taught builds a strong core, are one of the most common hidden causes. Here's a number that should stop you cold. A 2025 systematic review published in Scientific Reports, analyzing 27 controlled trials and over 1,300 postpartum women, found structured, targeted exercise closed this gap. A separate meta-analysis published in the journal Hernia, pooling 9 controlled trials, found these programs shrank the gap by an average of 8 millimeters compared to doing nothing, measured, on record, in peer-reviewed research. And there's a hopeful side to this too. This gap shows up in nearly 100% of women late in pregnancy. By 6 months postpartum, without any treatment at all, that drops to roughly 39 to 45%. Your body already knows how to partially fix this. The right exercise finishes the job. The wrong one undoes it. Today, I'm going to show you exactly what this gap is, which everyday exercises are quietly making it worse, and the real technique research shows helps close it, often without ever needing surgery. If you want health information explained honestly, with nothing left out, subscribe and tap like. That's how kingvitalyears reaches more people who need this. Stay with me. Here's what's actually happening under the surface. Simpler than the name sounds. Diastasisrecti, DRA for short, is a separation of the 2 large abdominal muscles running down your stomach, the ones that form a six-pack in people with very low body fat. A band of connective tissue called the linea alba holds those 2 muscles together down the middle. Picture it like the seam on a pair of stretch leggings. Firm, flexible, invisible, until it isn't. Repeated outward pressure stretches that seam thin, the same way leggings gape after enough wear. Thin enough, and the muscles it connects pull apart. A visible gap forms. That's the ridge or bulge you notice when you sit up, strain, or brace your abs the wrong way. You can check this right now while you're watching. Lie on your back, knees bent. Lift your head and shoulders slightly off the floor, like the very start of a crunch, just enough to engage your abdominal muscles. Place 2 fingers along the midline of your stomach, just above or below your belly button. Feel for a gap between the muscles. A gap wider than about 2 finger widths is generally what's considered worth having formally evaluated. Hold that number in mind. I'll come back to what to do about it. Pregnancy causes it because a growing baby pushes outward on that tissue for months. That's why most people only associate it with postpartum bodies. But pregnancy isn't the only cause. Heavy lifting without proper bracing, long-term weight around the midsection, repeated straining, and certain ab exercises done with poor form or too often. Same pressure, same seam, same result. In anyone. Now let's talk about the exercises that make this worse, because this is the part most people have never heard. Traditional crunches and sit-ups work by curling your spine forward against resistance. That movement generates significant outward pressure on your abdominal wall, right through the linea alba, the exact connective seam we just talked about. If that seam is already thinned or gapped, crunches don't strengthen it. They stretch it further, the same way pulling on a torn seam only rips it wider. Leg lifts do something similar. Full sit-ups, especially fast or high-rep ones, add even more strain. Even certain plank variations, done with poor form, hips sagging, core not properly braced, can push outward instead of drawing in. This is why so many people do everything right by traditional fitness standards and still watch their gap get worse, not better. They're training with the wrong blueprint for what their body actually needs. Let me tell you about someone who lived this exact mistake. Diane Foster, 42, from Boise, Idaho, spent 2 years after her second pregnancy doing daily crunches, convinced she was rebuilding her core strength. Instead, her gap widened from 2 finger widths to nearly 4. Her doctor finally measured it properly and referred her to a physical therapist, who explained that the very exercise she trusted most had been working against her the whole time. So, what does research actually show helps? The approach that's been shown to work is built around drawing the abdominal wall inward, not straining it outward. Physical therapists often call this a draw-in or transverse abdominis activation technique, engaging the deep core muscle that wraps around your midsection like a natural corset rather than the surface muscles crunches target. Here's a simplified version of how it works, and I want to be clear, this is a starting point for understanding the technique, not a replacement for a physical therapist assessing your specific case and pace. Lie on your back, knees bent, feet flat on the floor. Breathe in slowly through your nose, letting your belly rise. As you exhale slowly through pursed lips, gently draw your belly button down toward your spine, not sucking in hard, not holding your breath, just a slow, controlled pull inward, like your midsection is a corset gently tightening. Hold that gentle draw in for 5 to 10 seconds while breathing normally, then release. That's 1 repetition. Research-backed programs typically build this into sets of 8 to 10 repetitions, a few times a day, progressing slowly over weeks, never pushed to fatigue, never done until it burns. This is a controlled, patient technique. If you feel any doming or bulging along your midline while doing this, stop and mention it to a physical therapist rather than pushing through it. The 2025 systematic review I mentioned found programs built around this kind of controlled, deep core activation consistently outperformed traditional ab training for closing the gap. It's not about working harder. It's about working the right muscle the right way. How old are you? And did this happen after having kids or not? Tell me in the comments, because this affects far more people than most realize, and it genuinely helps me know who's watching. So here's the bottom line. This gap isn't a mom's thing. It's a pressure thing. And the fix isn't harder ab work. It's smarter core work. Here's what to do tonight. Step 1. Do the 2-finger check I just showed you and take note of what you feel. Step 2. If you've been doing crunches, sit-ups, or leg lifts regularly, pause them until you've had this properly evaluated. Step 3. Try the breathing draw-in technique gently, once, just to feel the movement, not as a full program yet. Step 4. Book an appointment with a doctor or physical therapist to confirm the diagnosis and build you a real plan. If surgery ever comes up, that's a decision for a specialist, not a YouTube video. If you've noticed a bulge along your midline and kept pushing through ab workouts anyway, that's worth a real conversation with a doctor or physical therapist, not something to keep working around alone. Everything covered today is for educational purposes only. Your health picture is specific to you, and the most useful thing you can do with this information is bring it to a doctor who knows your full history. If this gave you something your doctor never had time to explain, subscribe to Kingvitalyears. Hit like so this reaches more people who need it. And tell me in the comments, did the 2-finger check surprise you? I read every single one. Next time, I'm covering another core myth, the ab exercise everyone's told to do after 60 that can actually strain your lower back instead of helping it. You'll want to see this one. I'll see you in the next video.